We recently had one. I think he was maybe one-ish. Um, the mom called because he had a fever and was throwing up. And we get there, and literally that morning, the doctor gave a diagnosis of like a stomach bug. And it was like 12 hours later, and he still wasn't better.
Yeah.
And so we were kind of like, well, um, this is what your pediatrician said. We'll
Yeah.
still bring him to the hospital.
So
But
do y'all get you guys get to decide if someone is coming to the emergency room, or do you give the parents the decision, or how does that work for you guys? Or is it like you have to bring everyone?
um, I mean, honestly, I go into any call with the idea that like we're gonna take him to the hospital.
Hmm.
And even people that are like, I just want my vitals checked. I'll tell them like, well, you called 911 for a reason.
Yeah.
Like, load up, let's go. Um,
Yeah.
so like with a minor, um, if it is something like life threatening and like there's no guardian present, there's no relative present, it kind of falls under the idea of implied consent, where
Mm,
because this is something serious, like we have to bring this kid to the hospital, like it's life or death. But I've had calls where, um, like one, like the grandpa was there, they can't get hold of the mom or dad. So it's kind of like he kind of like this assumed guardianship. He
mm,
is like blood relative to this kiddo. So he kind of made the decision. Um, had one where there was some kind of incident like at a school and the mom wasn't there, but like on many calls where the parent is actually not there, like I just do a phone call and
mhm.
explain what happened. Because number one, it's their kid. They need to know.
Yeah.
But like just kind of informing them what's going on and then ask them like, you know, we need your permission to bring your kid to the hospital. Because
Mhm.
it's a very complex thing of they're a minor and so they're not technically able to decide for themselves. It even falls under like I had this 17-year-old who would turn 18 in like 2 months, but because of his birthday and physically, like whatever, we still had to talk to his parents. But as soon as I know
Mhm.
that they're 18, I'm like, okay, baby, you can decide for yourself what you want to do. So it's a very, it's a complex, complicated thing. But
Yeah.
my goal, honestly, is to just how do I contact these parents as soon as possible so I don't have to wonder, am I going down like a legalistic loophole?
Yeah.
Ugh, it is not fun.
No.
And then in those instances of life and death, like kids are fine. They are fine. They're dealing with whatever until they're not. And then
Until
they
they're
just
not.
tank so quickly.
Yep. Yep. And they can tank within like 30 minutes, and then you're like full everything. That's true. They compensate amazingly, and then all of a sudden they're like, "Ooh, I'm done."
um, thankfully, I think I've had so far one pediatric call on two where it was actually something really serious. And like when we first got there, we did like the preliminary checking vitals, getting a background, getting a history of what just happened, blah, blah, blah. But when we got to the back of the ambulance, I sat there and I'm like, okay, The kid's, pretty fine right now. Everything's checking out. But in the next 10 minutes, what if I have to do this? And it's just like the whole like I'm grabbing the Brazzel tape and already like, okay, you're in the, I don't know, like the pink range.
Yeah.
And I'm like looking at my dosages of medications and I'm like, okay, okay, we got this.
Yeah.
So,
Yeah. It's always
like,
so funny when they come up with their Brazos. We already have a wait whenever we get them in ICU, so, like, we're we're, like, set, you know what I mean? Like, we already know everything that we gotta get. If they're coming up to us, like, we're pretty, like, uh, micromanagers, so we have everything, like, lined up. I'm not sure if you've seen those, like, memes and everything of, like, ER nurses versus, ICU nurses. Like, all of our stuff is, like, perfectly lined up, and my drugs are pulled up and, like, highlighted, and, like, everything's, like, labeled with, like, this perfect handwriting, and, like, my pumps are, like, perfect. And then, like, an ER ER people roll up, and they're, like, throwing things on the bed, and we got mud on down their side of the face, and,
every cable that could be is all
Mhm.
tangled up.
Yeah, and then, like, we're like, "Oh, where did this piece of gauze come from?" They're like, "Oh, that's from the other 3 hospitals we just went by." Like, got it. Or we got vomit in our C collar, and we're like, "We're gonna change this out real quick."
Sometimes with certain patients, if it's
Yeah.
like, we've bandaged, we've taken care of the pain levels and stuff like that, I'll look and I'm like, man, like they've got blood, on their arm still and it's drying up or like on their face. And I'm like, oh, I wish I could clean this up. And this is kind of petty and probably wrong of me. But I'm like, man, that ain't my job. Like if I have time, I will.
Yes.
But at the same time, I'm like, somebody else gonna do that. That has them for longer than 15 minutes.
Yeah, 15 minutes is like
Um, yeah, I think that's a big gist of where I kind of wanted to go and stuff like that. Do you
Mhm.
have anything else that you want to throw in? Anything else you want to say?
Uh, oh, which okay, this would probably like drive you crazy, but hospital policies are we have to change out and take out IVs 24 hours that y'all put in after they get there. Yeah, yeah. We have to take them out. Some hospitals, it's just like change the dressing and everything, but most of them are remove the IV within 24 hours and start a new one. So I know that was like, I had to tell you, I had to let you know.
I get it,
Isn't
but
that sad? I hate it. I hate it personally because I don't want to have to restick them. I'm like, score. They got a solid one, and
right.
I'm like,
And so recently, I got a solid, I think I think it was a 22 in this kiddo, which it was warranted. Um, but I just remember like I got it as a just in cases,
yeah,
just because I was like, if I need it, I don't want to be behind on the 8 ball just because like I don't want to stick this kid. Whatever. Like, I mean, granted, I don't because I
yeah,
know it's traumatic for them. And
yeah,
even more than the grown 30 something year old men covered in tats who say I don't like needles.
yeah.
It's more
Loser.
traumatic for those kiddos. But so I got one and the whole way to the ER, I was just like, they're gonna pull it out. They're gonna pull it out. They're
Yeah.
gonna use their own.
Mhm.
And we got there and they used mine. And
Oh,
I felt like $1,000,000.
oh, I'm so glad.
But I guess in 24 hours it didn't matter.
Yeah, yep, they pulled it. They pulled it. I'm just letting you know.
I think it's
I know
also
it's
that
so sad. I
same
hate it. I hate it so much because then we have to go in and do another one, and especially if like the kid's been stuck multiple times, they know it's coming. You know what I mean?
Yeah.
They know whenever, there's 3 people holding down a 2-year-old, they know, okay?
I think that was also the same, I don't want to say chain hospital, but they have many facilities.
Mhm.
Um, that sometimes they'll pull out whatever IV we started anyways, like
Mm,
without checking if it's still able to flush or where it's at, anything like that. I've seen them. There was one patient that I was like, man, I'm lucky to get that line. And this is gonna be like their last ditch effort. And they took it out. And then
that's so
like
sad.
5, 10 minutes later, as we're leaving, I stick my head back in the room and they got the little Doppler ultrasound trying to find somewhere else for an IV. And then I'm like,
You're like, "You
man.
losers."
Right? I'm like, oh,
Like, "I
it's like,
got that without
fuck.
that ultrasound."
Exactly. It was also kind of like, no longer my problem. If you can't get it, that's on you.
Yeah, that's true. Oh, no, I never pull an IV without already having another one. That's insane. That's stupid on their part. Let's be honest.
Next.
I know.
Like, I
Like, I
get
was
the sterility of it. And like someone explained it one time, it's like it has to be the hospital's administered IV for whatever reason. But in my mindset, like a line is a line.
yeah, yeah.
Yeah. Hmm. Um, I'll remember that next time I get a line on these kiddos.
Yeah. Yeah, you're gonna be, like, angry, like, "Do I even need to get this? No." This is Well,
I'm
it's
gonna go
even
ahead and
so it's
write
not even
down.
just, like it's not even just field IVs, it's, like, if it came from another hospital as well. So, like, even if you guys are just transferring from one hospital to the next, we have to take it out. Yeah. Isn't that
Are you
crazy?
serious?
Mhm. Mhm. At least at the hospital I'm at right now. Not every hospital is like that.
Yeah.
Like I said, I've been to a few different rules, different protocol, but as of right now, I know, I was so sad. I hate pulling IVs. They're the
I
worst.
feel like the people that come up with these kind of policies need to go and do it themselves so they can go in the room for that kiddo who's been stuck 5 times and like you said already knows what's coming and
Mhm.
stick them again and
Yeah.
see how that
Look,
works out for them.
I know. This is a vent session. That's what this is right here. I'm here for it.
So on that note,
Also, I thought, yeah, on that note, look, I was laughing so hard at the 22 at the lips, the name of this podcast, because I'm like, 22? Is that going out their butthole? Like, that's so deep.
no, these are big
Obviously,
people.
different organs. Yeah, that's for like big people. Like, I'm like, oh, you'll love this. Ready? We're at 8.5 at the teeth. Like,
Okay.
that's that's the numbers I'm writing down in my report. 8.5. I'm serious. We're putting in like 3 O's into these kids.
Okay.
Yeah, I know, itty bitty. That's why I'm like, when we're with the story of my husband like waking up in the middle of the night, and I'm like literally holding on to a straw. It's like this big, you know what I mean?
See, I'm thinking of like having a whole fist on the tube. I didn't think about
Oh
like just the two little
no, I'm
fingers.
like, it's like holding on to his face like this. You know what I mean? Like chin and finger. Yeah.
I saw this funny sketch. I forget his name. Doctor it starts with a G. He's actually an eye doctor, but he like does all these videos with different areas of specialties with doctors. And one of them is a pediatric doctor, and he gets floated to like a general admission floor or like an ER floor. And like it shows him like opening a door. And he's like, these people are so big. Why are they so big? And someone was like, hey, can we give a liter of fluids? And he was like, a liter? What is
Yeah.
wrong with you? And they're like, it's a liter. Think
Yep.
of that.
Yep.
These people are so big.
Yep. Look, which I don't know. Do you guys hook up when you intubate someone, do you guys hook them up to like a ventilator or do you guys just bag them until you get to the
The agency I'm at, we bag.
okay. So then I don't know how much you know about like our tidal volumes and stuff. So like an
Mhm.
adult tidal volume is like, anywhere 500 to a liter, right? Well, on some of our kids, it's like 75 is our tidal volume, or like these NICU babies are like 9. I'm not even kidding. Like those are the numbers that we're made.
That's like it's like getting right to him and be like,
Yeah, it's like you're bagging like like you have this big bamboo bags and you're like whole hand,
right.
and then you just got okay, they're good.
You look at the
It's
BVM and
funny.
it's enough.
Yeah, yeah. Oh, it's funny. I mean, our range is obviously we have, teenagers with that big of volumes, but we also manage the really itty bitty ones too. It's funny, the difference. Pediatrics is weird.
With your 3.0 ET tube.
Yeah.
If I if I was ever about to intubate somebody and I looked at my partner and I'm like, hey, hand me a 3.0, she'd be like, oh, for what, an IV? Like, what are you doing?
Yep. Yep. Yep.
So, Meg, this has inspired me to go back to my protocols and training and go back over pediatrics
Oh, Lord.
because now I'm scared for whatever's gonna
No.
hold for the shift tomorrow.
Yeah. You can blame me on that one. It's fine.
I'll call you and be like, well, look what you did.
Yeah, I'm on for the whole weekend. Just let me know. Hopefully I don't see any of your kids that you don't want to see me. That's what I tell people all the time. They're like, "Oh, if my kid's sick, like I'm coming to you." I'm like, "No, you don't want to see me. Like I'm the
No.
worst. Like if you see me, we're like near death. Like you are dying. Like you do not want to see me."
You're not wrong.
Nope, you're not. I'm not. I'm so bluntly honest right now. Like,
I had somebody
yeah.
tell me one time, they were like, if I call 911, I want you to show up. I was like, what if you just didn't call 911 ever and like you took care of yourself? Like, no.
What if you actually went to the doctor when you weren't feeling good?
What if you took your
Like,
insulin? Mm.
no. Yep. Yep, that one hits home for a lot of people.
What if you stopped smoking cigarettes when you were diagnosed with COPD?
Great points.
Mhm. My chest is hurting. Can I finish this little cigarette? No. Anyways, so Meg, if that's all you have,
That's all
that's
I
all
got.
I have. How can our listeners and viewers find you?
Yeah. I am on Instagram at your rapid response nurse. I've got a couple of free resources out there for people, for new parents, to figure out if they need to call 911 to see you or if they need to go to the ER or just go to their pediatrician's office. So help decipher some of those key moments.
And like I said, it is very useful information, even from an EMS standpoint.
Hmm.
It's good stuff, and the resources are good. I've told a couple of parents on calls like about your stuff
Oh,
and like the resources you have. So hopefully they found you.
oh
Nah,
wow, thanks
I
for the
never get follow
references.
up.
Oh, yeah, you never get the follow up. You're just dump them off. Whoa, that was a crazy story.
Right. So I appreciate you coming on. Thank you for pouring your heart out, answering my questions, bringing up some good stuff.
Yeah,
And if that's all you got, that's all I got.
perfect.
And how I end every single episode. So with that,
The 22 at the Lips podcast is designed to support, not replace, the relationship that exists between a practitioner and his or her medical director. The views and opinions expressed in this podcast are those of the host, guest, and not necessarily of Master Medics. The information provided during this podcast is intended for educational and informational purposes only. It is not a substitute for your approved protocols.